Hi, I'm Dr. Dave Wendell from Natural Health and Wellness Center located here in beautiful Jamesburg, New Jersey. And today I want to talk to you about cardiovascular disease. Cardiovascular disease consists of several things: hypertension, coronary artery disease, stroke, congestive heart failure, congenital cardiovascular defects, and arrhythmias. One thing you need to understand with cardiovascular disease, we've established this month in our office that it's due to one thing and one thing only: inflammation. The inflammatory process in the body, last week our 7 pillars of health, it's pillar number 4. The inflammatory process in the body will cause decay and degeneration, leading to these symptoms in your body. So let's do a quick overview on cardiovascular disease. Cardiovascular disease is the #1 cause of death worldwide, meaning out of everybody that dies, half of them, their cause of death is cardiovascular disease. Secondly, it affects more women than men. Recent studies show that 42 million women a year in the United States died of cardiovascular disease, only 39 million men. Cardiovascular disease is responsible for more deaths per year than the next 7 causes of death combined. It's something that we should really take seriously. It costs our country over $500 billion a year, and also we need to assess diet. Nobody's doing that. Why? I just don't understand. If we go back about 100 years ago, the average American ate a diet that was about 50% in fat, 0 to almost no sugar. And the cause of cardiovascular disease amongst deaths was about 1%. Here we are today in 2014, cardiovascular disease is claiming half the lives, and we look at our fat intake has dropped from 50% to 33%, and of that, 40% is hydrogenated oils. We also look at sugar intake. The average American, depending on the source you use, consumes anywhere from 1/2 to a pound of sugar every day. And we know sugar, back to pillar 4, is definitely inflammatory. So we need to look at what we're eating and reassess and change our lifestyles to decrease that inflammatory process. Next up, let's talk healthy blood pressure, since it's cardiovascular month. When we look at blood pressure, the average doc wants you to have a blood pressure of 120/80. Well, that's great if you're young and in decent shape, but as we age, should 120/80 really be what our blood pressure is? If I take somebody who's 20, 30 years old and they're relatively active, I would expect to find that. But as I get a person who's aged and they're 50, 60, 70 years old and not quite active, 120/80, I'd be concerned what's wrong with them, why is their pressure so low? And so if we look at what blood pressure should be, for a male, 100 plus your age for the top number. So if you're 60 years old, 100 to 160 would be your top number. If you're a female, 60 years old, it would be 90 plus your age. So that would be 100 to 150. And because as we get older, our vascular system becomes more rigid, and so our hearts have to beat a little stronger. And so before you get on that hypertensive medication, check and see what's your lifestyle and diet like. Are you active or are you inactive? Are you getting enough sleep? What is it that you're doing? And actually assess your blood pressure to be healthy for you, not healthy for the average 20-year-old. Next up, the cholesterol myth. Let's put this to bed right now. There are no studies really that show how using a statin drug improves the health of a person. Yes, I know the NNP numbers. Okay, 1% of the people taking statins have success, but it causes 3 people to have ill health. So it's really not a fair trade-off. Okay, statin drugs do things like lower your cholesterol. Every cell in your body requires cholesterol for its phospholipid membrane. That is the membrane around the cell. When we start decreasing cholesterol, we start affecting the way our cells work, particularly our brains, our minds, our nervous system, but also our hormonal system. We cause toxic buildup in the liver. The liver can no longer produce cholesterol. And so we really start to affect our immune system and inflammation in the pillars. Next thing with statins, we lower CoQ10. Well, who wants that? Lower CoQ10 means lower energy. So what our medical providers do is they say, well, go take some CoQ10. So you go to the store, you buy this chemical formulation off the shelf, which is more toxic to your liver, and it's further creating problems with your body. We also know that statins cause an increase in mutation of your mitochondria. Those are little organelles inside your cells that you're required for energy and for your DNA. And so when you get mitochondrial mutation, you actually start to affect the body and a lot of energy production. Next is increased dolichol. That just means your body's going to have a hard time processing and synthesizing protein. So if you don't like those little bye-bye arms, stop taking statins. If you don't like saggy, droopy skin, stop taking statins. Of course, do work with your medical provider on doing that. Don't just take my word for it. Statins also, you need to understand, increase cancer, they increase diabetes, they increase the cause of depression, suicide, dementia, memory loss, and of course, heart failure. So really look into what the side effects are of these drugs that you're supposed to be taking for cardiovascular disease. And once again, understand that statins and cholesterol have nothing to do with cardiovascular disease. You'll find out more about that on our next video.